Good morning, ladies and gentlemen. I'll just paint this mosaic in perhaps a slightly different way. For over 100 years, Mayo Clinic has been known for focusing on the patient and providing the highest quality health care imaginable, integrated with education and research. Our primary value has been and remains the needs of the patient come first. That's what we've done, and it's been successful, and much more needs to be done. Our core business at Mayo Clinic is to take all the knowledge that we know and all the information that's available and find a way to focus that on individual patients and make that more available to them. And as the speakers before me mentioned, we're now moving to an era where it's possible to deliver advice and care more remotely. The explosion of information and the opportunities to harness that information and bring it to the individual person, filtering it and focusing on the individual, are now in front of us. And that presents a wonderful opportunity for a patient-centered, teamwork-oriented healthcare group like Mayo Clinic to work with a comprehensive academic university with expertise therein in biomedicine, biodesign, bioinformatics, biotechnology, and that's really what this is about. At Mayo Clinic, we excel at patient care, at educating our healthcare professionals of the future, and in bringing the full array of research from basic science discovery, lab-based clinical research, and clinical trials and population work to the care of the individual patient. So these are two, in my opinion, strong organizations coming together for that purpose, to extend that purpose beyond the individual, coming to see a doctor or a nurse face-to-face, but more broadly. I'll give a couple of examples, perhaps three, that will perhaps be helpful for you to see how this could work. A few weeks ago here in Phoenix, we announced the launch of the Mayo Clinic Proton Beam program, a program to deliver proton beam technology to patients with cancer, patients of all ages, children, adolescents, and adults. And we will have these cancer facilities, cancer treatment facilities, built in Phoenix and in Rochester, Minnesota, as we mentioned. Now, how does this relationship between Arizona State and the Mayo Clinic coming together help with that? Well, in this comprehensive university, as you would expect, there are world-class physicists, economists, supply chain leaders, business leaders, and so on, who can work with Mayo Clinic to anticipate problems of bringing this technology to large groups of patients in the right way. So that will work extremely well. A chance occurrence happened not too long ago. We're a leader in myeloma cancer research and care. Dr. Rafael Fonseca from Mayo Clinic in Arizona and Dr. Ariel Anwar, an astrobiologist and geologist at Arizona State University, met each other at a scientific meeting and realized they had a common interest and expertise, and that's in calcium metabolism and bone formation. The ASU physicist, geologist, astrobiologist has been asked to solve the problem of bone loss in astronauts. And Dr. Fonseca is looking at a way to rebuild bone in patients with cancer. And they're now writing a grant to work together, bringing those two wonderful disciplines together under with one focus. An idea that Dr. Crow has brought to our attention is a new way, perhaps, of looking at how we handle the challenge of childhood obesity in the United States. As you know, that's one of our largest healthcare imponderables. We haven't solved this one yet. And Dr. Crow said, what if we brought the graduates of our Teachers College together with Mayo Clinic, and many or most of them had a minor in health? They could then bring this expertise to our classrooms around the country. So I don't know if that was at 7,000 feet or 5 feet. I don't know where that was. But between the three of us, I think we've painted a picture that was started by Dr. Trastic and Dr. Crow and is now blossoming into an important collaboration for these organizations. And we look forward to your questions. Thank you very much.